All right, good morning. Thank you all for taking some time today to review the 1094, 1095B reporting for the 2024 calendar year. It is officially called Reporting Minimum Essential Coverage. My name is Corbin Granger. I'm the Senior Vice President of Compliance here at Town Benefits, and it's a privilege to have you today. Just a few housekeeping items. We do record and post all of our webinars on townbenefits.com. After the presentation, you'll receive a PDF of the presentation and the link to townbenefits.com where the webinar will be posted. And if you have any questions, you can put them in the question box and we can review them at the end. So as you know, I am not a lawyer or an accountant, so this is not legal, tax, or accounting advice. And in fact, we say that the information is based on current IRS regulatory guidance, but Congress did just pass a law. I don't believe it's been signed yet, but it's eased some employer reporting restrictions. But before you get so excited, it's a little less than I wish it would be, but nonetheless, if it fits for you, it works. This presentation is only intended for employers that are not considered applicable large employers. So if you're an applicable large employer with a self-insured plan, you report this information on the 1095C. So let me repeat that again. If you are a smaller employer, so you're under 50 FTEs and you have a self-insured plan, a level funded plan, a balance funded plan, this presentation applies to you. So 2024 forms and instructions, what we're reporting is the minimum type of coverage that is qualifying coverage under the ACA. Basically, that's essentially preventive coverage. Now, the reason this reporting existed was to enforce the individual mandate penalty. But I believe it was 2019, Congress took the individual mandate penalty to zero. It's not completely stricken, it's not revoked, so it could come back in some form at some point in time. But right now, the federal individual mandate is zero. So it's interesting that we still have to file these forms with the IRS and provide the statements. It goes to the responsible individual. So that's going to be your employee or your individual who's on COBRA or state continuation that maintains the coverage. You as the employer coverage provider, you provide those statements, and the due date for providing the 1095B is by March 3rd, 2025. Now, you as an employer coverage provider also file the forms with the IRS. So you're filing a 1094B, which is the transmittal form. So you think of it as a cover sheet, and then the 1095Bs. The due date for filing electronically is March 31st, 2025. Now, last year was the first year that all entities, unless you issued 10 or fewer tax returns, and that means every tax return. So basically, every single entity needs to file electronically with the IRS. And quite frankly, I think it's a lot simpler because rather than typing on these PDFs and putting them in an envelope and sending them to the IRS, it's what happens is, and we don't advocate specific TPAs, but yearly is one with which I'm familiar, e-file for biz. And basically you're buying a license so that they have the spreadsheet that you complete and using that spreadsheet. So a lot of times you can take the information straight from your payroll system or whatever and copy and paste it onto the spreadsheet. It will then file it electronically through the AIR system. It will print the 1095B forms for you. It will print and mail them for you. So remember, as I go through this presentation today, I am showing you the actual form, but that correlates to the codes that they're going to put on that spreadsheet. So there was a modification just passed by Congress to the 1095B reporting and actually to 1095C reporting, but again, that doesn't apply here. So it's called the Paperwork Reduction Act, nice term. amends the ACA by no longer requiring employers and health insurance providers to send tax forms to the covered individuals under their health plan. So basically what that means is you don't actually have to provide it to the covered individual. You do have to provide it when it's requested. Now this was just passed, so I don't know what the actual rules around this are going to be, where you have to post information, what do you have to do. And if the covered individual requests a form, it has to be provided by January 31st or 30 days after the date of the request. Employers, insurance providers, you've got to inform covered individuals of the right to request a form. And as you know, with everything involving the IRS or any tax form, there's going to be a way that is proper to do that. It's not yet signed, but what I'd like to remind everyone is you as the coverage provider, so as the employer of the self-insured, level funded, or balance funded health plan, you still must file the 1094B and the 1095B with the IRS. So these forms are very simple to complete. It really doesn't take a lot of time, especially if you're using one of those TPA spreadsheets. So I recommend you still distribute the form to individuals that were covered in 2024. And the reason for that is undeniably, individuals will call you, they'll go to Jackson Hewitt, they'll go somewhere to get their taxes, and they'll say, I need to have this 1095B and I need it by Friday. And they don't really need it, but it's something that's that the tax service tells them. So if you're going to have to file it with the IRS, I recommend that you just distribute the forms to individuals as well. So if anybody out there has a health reimbursement arrangement, that is considered a self-insured group plan. So if you have what's called an individual coverage HRA, an ICHRA, that is considered a self-insured group plan, and you as the employer must report under the ICHRA. If you have a self-insured, level-funded, balance-funded plan, and you have an HRA, you only report the insurance coverage. So for example, you have an Anthem balance-funded plan, and the deductible is $3,000. And you also have an HRA of $1,000 that will reimburse employees up to $1,000 to help them with their deductible. Since you're reporting for the self-insured medical plan, you don't have to report for the HRA. If an employee is enrolled in an HRA, but not enrolled in your health plan, you have to report the HRA. Now, in all my 20-some years of experience, we've never had a plan where there was an HRA for people that were covered under their spouse's plan, right? So if your spouse has a group health plan and your HRA is reimbursing them, you do have to report. That is so extremely rare, but it is in the rules, so I wanted to mention it. Now, there is certain state filing required for the MEC for individual mandates, because certain states do have individual mandate penalties. And so then you as the employer are required to file additional returns and provide additional information to the state. So for example, New Jersey, Vermont has one, but there's no penalty. Washington, D.C., California, Massachusetts, and Rhode Island. Now, these states may have to report sooner than the federal filing requirements. I believe California is by January 31st. I'm not an expert in all those states, so you should consult your tax advisor. But another thing that's helpful when you're using a TPA to actually file these forms is they will have the option to do the state reporting for you. But you want to keep that. So with more employees working remotely, that may come into play. So what are you reporting? You're reporting covered individuals. So it's not just employees. So you're tracking employees, spouses, and dependents, and each month covered for that individual. One day counts for an entire month. So for example, if one of your employees has a baby on September 30th of 2024, you're going to put an X to show that they had coverage in September, even though the baby was born on September 30th. You're going to report with the social security number or the taxpayer identification number. Some of the employer reporting things passed by Congress provided a little relief on that about how, you can put the birth date in there. But you provide it to the responsible individual. So if you're covering someone on the plan and they're dependent, well, they're not a tax dependent, but they're 25 and are still on the health plan, you only have to give it to the employee, the responsible individual. They can make a copy of it and give it to their child. So this is the transmittal form. Again, this is what the form looks like, but when you're going to go through a spreadsheet, you're just going to put your name, EIN. This is always done last because you have to put on line 9 the total number of 1095B forms submitted, and then you will electronically sign it. The 1095B is the individual statement. So there are 4 parts to it. Part 1 is the responsible individual. That's going to be your employee or your qualified beneficiary under COBRA or state continuation. Part 2 is information about certain employer-sponsored coverage. And Part 3 is where the insurer or other coverage provider reports information. On Part 4, you also, that's where you list the covered individuals. Okay. So Part 1, the responsible individual. It's really like a W-2, the name, address. So I think it's very simple in using these spreadsheets because you can just dump that information in. Now, on line 8, you have to put in a code. So you're going to enter the origin of the coverage. Anybody having an employer-sponsored, self-insured, level-funded, balance-funded plan is going to put in code B. If you have an ICRA, you're going to put in a code G. This presentation isn't for collective bargaining plans, but there is E, multi-employer plan. But really, I think everybody on the line, or most everybody on the line, would be reporting either B for their self-insured plan or G for the ICRA that they're sponsoring. So we've gone over Part 1. Part 2, you skip Part 2 if you entered B on line 8, and that's on page 6 of the instructions. So if you entered B that you have a level funded or balance funded plan, you skip line 8. If you have an ICRA, then you put in a G, then you will complete you will complete Part 2. Part 3, that's where you put issuer or other coverage provider. So for those of you with self-insured group health plans, that's where you're going to put you as the covered provider. And lastly, you're going to put all covered individuals under Part 4. So you're going to repeat, you're going to indicate the responsible individual again. So that person will go first. You list the first name, middle initial, last name. You list their social or taxpayer ID number. You enter a date of birth only if you don't have a taxpayer ID number. And you're going to do it year, month, day. If the individual was not covered for all 12 months, you list every month the individual was covered for at least one day in the month. So for example, if you had John Smith, his tax ID, you don't complete the date of birth, and if he was covered all 12 months, you check the all 12 months box. Perhaps he got married during the year and he added his spouse to the coverage in May of 2024, then you'll list the spouse and you'll only be checking the months from May through December. So we've moved to the questions part, and I want to thank you. And so let me